Everybody, my name is Tamiris Cristhina Resende. I'm a PhD candidate from the Federal University of Rio Grande do Norte in Brazil. I am a visiting research at University of Kent, United Kingdom, and together with some researchers from the University of São Paulo in Brazil and the University of Kent, United Kingdom, we wrote this paper entitled How the United Kingdom Government Faced the Coronavirus Disease Global Pandemic. So, at the beginning of May, United Kingdom, United States, Italy, Spain, and France were the countries with the most number of cases. United Kingdom was the fourth in number of COVID-19 cases, and the United States was the first in number of deaths by COVID-19. I mentioned this period of time because we wrote the paper in this month, and at that point, health systems were close to collapse, and United Kingdom was criticized because initially they were slow to develop a national response to pandemic, but the national health system maintained the capacity in intensive care units, and the United Kingdom government constructed a Nightingale Hospital in London to take up to 4,000 COVID-19 patients. So our objective was to analyze how the British government has responded to coronavirus disease 2019 outbreak, emphasizing which measures were adopted to avoid the spreading of the virus. So while there has been this focus on hospitalization, we are trying to understand why the NHS has managed healthcare response to the pandemic. Our literature was in intergovernmental coordination and primary health care. We searched on the Lancet, Medline, Web of Science, PubMed, and we also pay attention to guidelines documents from the World Health Organization, for example, such as the diary situation reports, and we conducted a documental analysis in official documents published in coronavirus section in the official government website, and we analyzed around 500 news speeches from the prime ministers, communication, guidance, and our main words were measured, coordination, conscious general practice, and primary health care. These words guide us in this research. So we decided to analyze the guides to understand the coordination and cooperation of the actions in 4 periods of times. In the first case, in the end of January, the month of February as a month where they developed prevention measures, and March as a month where when the first action plan was taken, and the lockdown between the March 24 and May 6. We know that the lockdown didn't finish on May, but we finished our analysis at that point. So here we have important graph. We summarize a history of government actions and coronavirus cases and deaths. Follow me. The blue line that we are seeing in your screen, it's the daily lab confirmed cases in England. So you can see that in the beginning of April, we have lots of cases of coronavirus, and the crisis starts to decrease after, to be more specific, after the middle of April 14. And we have the red line, as you can always follow with me. The red line is about hospital deaths. It almost followed the blue line, the number of cases. And we have, at this period of time, in the beginning of April to the middle of April that we have around 1,000 of deaths each day. So the Prime Minister started to chair the cabinet meeting on the beginning of March. The lockdown started on March 23rd, and the lockdown was extended in April. Even with the number of cases, the number of cases were decreasing and the number of deaths, they decided to extend the lockdown because of the one possible second wave. They were trying to prevent this. So in this timeline, you can see the governmental actions in the first case period of time. In January 21st, the World Health Organization published the first situation report, and the day after, the British government started to monitor direct flights from Wuhan, China, and the first cabinet meeting by the end of January about the coronavirus, they started to discuss measures to contain the disease, and central aspects were to avoid imported cases and to prepare governmental cases in case of community transmission. That this period of time was about this. It was trying to prevent imported cases. So in this image, this picture you are seeing in front of you, it's more about the coordination and cooperation. United Kingdom, we have this kind of mechanism, the COBRA. It's very important to coordinate measures in important issues, United Kingdom. So as usual, the Prime Minister is the head of the cabinet. And in the case of coronavirus, we had the participation of the Scotland First Minister, Wales First Minister, Northern Ireland First Minister, and we have also the United Kingdom Chief Scientific Officer, the Chief Medical Officer for English and UK Medical Advisor, and emergency services leaders also taking part in this cabinet to act and to prevent the spreading of the disease. The second period of time was about developing prevention measures. The timeline of governmental actions in this point is the government started to invest money to develop a vaccine, and February 10th, the Health Protection Coronavirus Regulation 2020 were introduced, and we have a four-part plan in the end of February started to present to Parliament. This plan was about 4 parts: contain, delay, resort, and mitigate. We call this third period of time we analyzed, we call the first action plan, that because the plan was presented in the end of February, but the plan was taken put in action in this moment. So in the beginning of March, we had the first death of patients with COVID-19 in UK registered. And March 9th, we have a task force to bolster local response to coronavirus. And March 12th, the government announces a movement of the contain phase, where they're trying to avoid important cases and the spread of disease, to the phase of the delay. This delay phase was about trying to protect the national health system, trying to maintain the intense care units available, and trying to protect the system from a possible collapse. And the lockdown, where all non-essential services started to be closed, and also the universities, they started to work doing lots of home office at that point. And they present a new plan that is about suppress, child, treat, and palliate. And on March 25, we had the Coronavirus Act. That's very important group of laws, a big law where you have lots of guidelines and rules to deal with this coronavirus in all nations. And by the April 16th, the lockdown was extended. I showed to you the cases were decreasing, the number of people with coronavirus were decreasing, but they decided to avoid the second wave and extend the lockdown. So, final considerations. The decision making was taken in two directions. One, preventing the disease spreading, and the other, treating ill people. The preventing disease, it's more about the primary healthcare actions, and treating ill people, it's about the high complex services offered by the hospital. So it was very difficult at that point to coordinate these two actions, two group actions, because it's very different the way you care the disease, preventing the disease, the way you treat and cure the diseases. So there are different types of resources involved. So this is a very complex moment, challenge faced by all the governments around the world, not just only the United Kingdom. So we observed a great cooperation, coordination among the national levels in United Kingdom. For example, the nations, Wales, North Ireland, Scotland, England, they agreed most part in the coronavirus measures, and the recent history. We had different point of views, for example, with the coronavirus, with the Brexit, the nations uh, didn't agree with all the nations had different points of views about the Brexit, and the coronavirus situation was the opposite. They were very aligned in all actions they were taking to prevent the disease. We observed that the COBRA, the Cabinet of C, it's really leading in coordinating all actions against the COVID-19. So this is really an important way to understand coordination in United Kingdom. And the limitations of this study is that we just focus only on health measures, but we know that this point, that time, the COBRA and the coordination United Kingdom, the government had other types of actions. For example, closing the schools, they have actions to protect the business, the enterprise. So we advise if you want to understand what happened United Kingdom at that point, you could try to focus not only in the health measures, but trying to understand these other types of measures adopted as well to protect the economy. So thank you very much for your attention. It was a big pleasure to be here with you in this Political Studies Association virtual conference. You can send me your questions, and thank you very much for this opportunity.